Welcome, Dr. Akshat, and thank you so much for your valuable time. I know how busy you are treating diabetics and pre-diabetes and a whole load of other diseases, but we wanted to pull you out because I think pre-diabetes is becoming an epidemic, like literally like type 2 diabetes. And like
Correct.
I always say, symptoms are never bad things unless we handle it the wrong way or we ignore it. Pre-diabetes is simply nothing but your body giving you early warning signals. And if you work on those signals, you can reverse pre-diabetes easily. At the same time, if we leave it untreated or we don't make the right lifestyle changes, then it becomes something which is far worse. It moves into type 2 diabetes and other metabolic syndromes, which is unnecessary and can be prevented. So once again, thank you for your time. Dr. Akshat, over to you. In the simplest way possible, can you explain exactly what pre-diabetes is and why do we need to take this seriously? Let's start off with that, please. Yeah.
Thank you, Luke, for having me again. So, guys, so what exactly is pre-diabetes? So, obviously, the way the name suggests, it's pre-diabetes. So, it's before diabetes, right? So, borderline diabetes, pre-diabetes. So, essentially, what it means is we all know when we diagnose diabetes, we talk about blood sugar levels and we talk of something called as HbA1c. That's the glycosylated hemoglobin. Okay, so that's the 3-month average of all your sugars predominantly. So pre-diabetes, what it means is that the sugar levels have started to increase, but they're not high enough to be diagnosed as diabetes. So it's like one step before diabetes. So let's say that your fasting sugars have started showing above 100, okay, but maybe they stay around 100 and maybe 126. The PP sugars, the postprandial, which is 2 hours after a big meal, okay, is, let's say, going above 140, but not reaching 200 or above 200, okay. But from a pre-diabetic perspective, what I would suggest is actually looking at more from a HbA1c perspective, okay. So let's say your HbA1c is 5.7 to 6.4. If you fall into this category, 5.7 to 6.4, then theoretically you fall into the pre-diabetes category, okay. So this is something that we really need to be careful, all right. And when you talk about the importance of this stage, I think this stage is even more important than the diabetic stage, because there are two ways, from a mind perspective, there are two ways of looking at this stage. Okay, if you're diagnosed as a pre-diabetic, a lot of people panic, but there are two ways. One is, either is it a path towards diabetes, or is it your chance to reverse diabetes? So we got to make a decision in our minds. Are we going to finally go into diabetes, or we're not going to? We're going to make the changes. We are going to make the changes and reverse the pre-diabetes. That is why this stage, awareness of this stage is extremely important. What is important is, Luke, you will not believe, if you look at the numbers, it's about 1 in 3 or 1 in 4 individuals actually are pre-diabetic, and they don't even know about it. So about 8 out of 10 people don't even know that they're pre-diabetic. So
Right.
that is the whole scare, that we don't know. There is so much of lack of awareness about this. But just because we say it's pre-diabetes or it's borderline theek ho jayega, when we don't do about it anything about it, it is. So the chances of pre-diabetes, not, if you don't do anything about the pre-diabetes, going into diabetes is like in 10 years, in less than 10 years, if you don't do anything about it, there's a good 90% chance that it will go into diabetes. So that is why this stage is extremely, extremely important.
Yeah, no, I like that you brought up the point because a lot of people do it without the HbA1c, but it's good to correlate the HbA1c because, like you said, it's an average of 3 months. So, sometimes like, Diwali or the Christmas season, a lot of people feast a lot, but, an A1C will give us an average to make the right correlation because sometimes, it's not always that pre-diabetes has to become diabetes. I wanted your take on that as well, because a lot of people believe that if they're pre-diabetic, they are 100% going to get diabetes. Is that true, Dr. Akshat?
So like I said, if you don't do anything about it, within 10 years, you will get diabetes because it is a precursor. That's how we look at it, because there's something not right. Whether we talk about insulin resistance or the insulin is not getting produced enough. So either way, there is a problem. It could be family history. We could talk about PCOD, maybe a little bit of heart disease, steroids. It could be anything. But there is some issue. That is why you're going into pre-diabetes. But you have to make the changes. If you make the changes, you can reverse it. Whether you're talking about medication, whether you're talking about lifestyle changes, that's a different problem altogether. But unless and until you do something about the pre-diabetes, within 10 years, you will go into diabetes. Let's put it that way.
Absolutely. I've seen that in your work. I mean, pre-diabetes has become the most easiest thing that the team handles right now, if people are willing to change their lifestyle, of course.
Correct.
Okay,
Correct.
so, insulin resistance is also becoming a kind of a buzzword for all the right reasons, because for the longest
Correct.
time, people were only focused on HbA1c, they were focused on their diabetes levels and their sugar levels. But insulin resistance today is a risk factor for cardiovascular, it's a risk factor for most cancers. And what is the correlation between diabetes, pre-diabetes, insulin resistance, and also something which is uprising amongst all the young girls, which is PCOS and PCOD? Can you
Correct.
explain that, please?
Yeah, Luke, I think that's a very important question because insulin resistance we've been talking about it since a long time, but now it's actually showing, it's not just a concept, it's really practical. So I think I spoke about this the last, video also, but I think I'll talk about it again. So, that whatever we eat gets converted into sugar, which is actually the food, the energy for the cells. Okay. So this sugar has to enter into the cells. But unfortunately, body is not that simple, right? It can't just go open the door and enter. There's a big lock on the door. So you need a key. Every lock, you need a key. And the key is insulin. Okay. And insulin is produced by the pancreas. So although what happens is that the pancreas is producing insulin. Okay. So there's no problem with the pancreas. The pancreas is producing enough insulin. Okay. But what is happening is the key, the insulin, is not fitting in the locks. So because it's not fitting into the locks, the sugar is unable to go into the cells. So because it's unable to go into the cells, it is flowing in the blood. So the signal to the pancreas is that there is still blood, there is still sugar in the blood. So it's producing more and more and more and more insulin. Okay. And because this connection is still not getting corrected, for whatever reason we're talking about, if it's not getting corrected, the pancreas, the beta cells in the pancreas will go into exhaustion. And that is when we look at pre-diabetes going into diabetes 100%. Now, right, when you talk about, so that is a very direct correlation between insulin resistance and pre-diabetes. Okay. When we talk about PCOS, again, it is a known fact that insulin resistance is one of the reasons, which is, let's say it's a causative agent, whether PCOS is caused because of insulin resistance or insulin resistance is causing the PCOS. Honestly, it doesn't matter because they come together. They've been shown to come together. And what happens is that if you don't take care of the insulin resistance, even before the HbA1c starts going up, eventually what is seen is that if the lady, the girl, if the menses are not regular, one, and second is that if the weight keeps going up, you are definitely going to go into pre-diabetes. So let's say that PCOS, uncorrected, uncontrolled PCOS, will eventually lead to pre-diabetes. I think that is the most important link that we have to remember.
No, absolutely. And I'm really happy you speak about that, because in the medical world, nothing against it, they only look at symptoms. But now we need to start correlating this, because what happens is when a young girl or a woman comes with PCOS, it is also necessary to look at their HbA1c. It is necessary to look at, their, like you said, gauge for insulin resistance, as well as thyroid function, the entire endocrine system. You can't just take parts of it. The entire endocrine system has to be looked at 360 degrees. So what are some of the symptoms or the signs that you will see as a doctor that can pre-warn us, besides the medical test, about possible signs, weight gain being the most relevant, unexplained weight gain? What else do you see, doctor?
See, unfortunately, Luke, the biggest problem with one is diabetes, you don't see symptoms. So pre-diabetes, the chance of getting a symptom is far-fetched. Okay. But if we really want to kind of, break it down, we have this, this darkish discoloration, which comes on the neck, sometimes on the armpit, sometimes on the back, Then there are these random, you just get skin tags over the, along the eyes and all, you can get on the back and all. So the skin tags can be a sign of insulin resistance. The blackish discoloration, which is also called acanthosis dicrecans, is like quite, a diagnostic of insulin resistance. Okay. So these two things are very important. Second is when you talk about weight gain, I would actually say, talk about belly fat gain. If you can see the belly fat increasing, that's the visceral fat going up, that's 100% a sign of inflammation. Okay. Slowly, what you will realize is the HDL, the good cholesterol, starts coming down. The triglyceride starts to go up. Okay. And there's a good chance that the liver enzymes start to fluctuate. They start to go up. Okay. So if you see this kind of a phenomena coming in, even if the HbA1c is not, gone, let's say it's about 5.6, 5.7, you're already, you're headed for insulin resistance, you're headed for pre-diabetes. That's going to be a problem. And one more thing, when we talk about, the blood test, when we talk about fasting insulin, when you talk about PP insulin, okay, there's a good chance it might come normal. There's a good chance it might come normal, okay? But you still can't ignore the fact. If you can see your weight going up, if you can see the belly fat going up, you don't have any other symptom, okay? But you can just look at your weight and your belly fat. You have to take action. I think that is very important. We can't just rely on a piece of paper. You have to take action. If you can see there's a problem, if there's a symptom, you have to attend to it, basically.
Right. And that's why you need to assess lifestyle because, I mean, in these cases, especially the complaints when a woman or a man or a young girl or boy say we're doing everything, we're exercising, we're eating well, but yet there's unexplained, weight gain in the belly area. That's all the more. So lifestyle has to be assessed along with just a medical report. Because like Dr. Akshat said, you just can't go with the reading. We've seen so many cases where the A1C is fine, the PPs are fine, but yet there is a considerable gain and darkening of the skin, dark pigmentation of the skin in the groin areas, the armpit areas, like you said, and behind the neck. So that's fine. But the biggest question is, do you need to start medication if you're diagnosed with pre-diabetes?
Oh, so that's a difficult question to answer in one word, but very, very honestly, if I really had to choose, I would say no. I would say you shouldn't really jump to medication. So let's say that, one favorite medication or the first line of medication is metformin. Whether we are talking about PCOS or we are talking about insulin resistance or we are talking about pre-diabetes as 3 separate categories also, metformin comes like as the first, line of therapy. But I personally feel that every individual, if you are willing, the reason I'm saying this, if you're willing, is because the doctor or the nutritionist, or, it has to be teamwork and you have to kind of be motivated enough, have a reason enough to make the change. So if you are willing, then give yourself 3 to 6 months to start making the changes and then assess. If the numbers, I can't even say if the numbers will come down. That's for sure. You are going to feel better and that will happen and you will not require medication. Okay. Now, there is a smaller percentage of people, okay, we talk about PCOS, we talk about heart disease, we talk about steroids, we talk about obesity, we talk about very strong family history, okay? If there are some cases like this, maybe, it could make sense, to start off metformin a little early, make the changes along with metformin and then take out the metformin, So use metformin as a crutch, the way you say, use it as a crutch, get your desired results, 3 months, 6 months, 1 year, depending on, case to case, use it, but then make sure you're working towards taking it off. So I think that would be the safest way to go about it.
So again, it comes down to assessment of lifestyle. You want to look at your genetic predisposition, your family history, whether you also have high blood pressure and other complications to decide whether you need to take the medication. So I think in short, what Dr. Akshat's trying to say is, you don't have to be against medicine. You got to make the right informed decision. If the odds are in your favor, then great, you can get away with good lifestyle. But if you need the pill, take it as a crutch so that you stabilize, it doesn't get worse. And then as your lifestyle gets better, you can slowly work with your doctor to wean off the drug. Dr. Akshat, what I've been noticing of late, we're getting a lot of clients, young boys, middle-aged men misusing anabolics and steroids and all of these bodybuilding supplements. Can you talk about, because we've seen a complete change in their CBCs and their blood sugar levels, steroid use, as we know, clinically anyway, increases your blood sugar levels and can even induce, pre-diabetes or diabetes at some point. But what about all these anabolics and diuretics? Because a lot of diuretics are also include women, because a lot of women use diuretics to flush out excess water. So they feel they're puffy, or, people say, oh, you're retaining water, and they start taking diuretics. Some of them even loop diuretics, which flushes out water, but creates havoc with the body. Can you talk about that, please?
I think, Luke, we'll have to do another session for this because it's so important and so vast. And unfortunately, now I'm not saying social media is a good thing or a bad thing, but the amount of information and the amount of graphic information that we see, people doing so many exercises and, they are so buffed and, the cuts and the definition and all, it becomes very easy to want the same thing. Okay. And unfortunately, we can't be exactly as buffed as a person is looking in a video. There's a lot of oiling which goes and, there's a lot of lighting which goes, but we as a lay person, we will take any help and support that we get, right? That's the whole point. So it's very easy. There's a lot of easy access to steroids nowadays. Again, not pointing fingers, but you can get it over the counter very easily. They don't need my prescription or an endocrinologist prescription anymore. Unfortunately, it has become a market now. Okay. But it is a known fact. We will not, I mean, it's so easy for us to say we will not take a steroid, but, I'm okay to pump in a steroid for, a nice shoulder cut. That's the whole problem. And we don't realize, and probably we are too young, even too young to realize what consequences we are going to face 20, 30 years from now. Okay. Because when you talk about steroids, okay, it doesn't come only with steroids. We talk about diuretics the way you said, because you want the definition, you want to throw the body out. People stop taking salt. They just cut off salt. Then there's something called as aromatase inhibitors. Again, that is given to actually mask the effects of the anabolic steroids. Okay, so you're not getting into one thing, you're getting into something which is so unknown, and you don't know how to handle it. You're too young to know this, and you're just following someone's guide. Why? Because you're going to get really buffed arms and a chest, so that is what is extremely scary. Okay, the things like they will increase water intake, they'll drop it. And I mean, so like I said, there's so much going on in the body, and they don't feel anything now. Right now, they're feeling too good because they're too young. But you start crossing 40, 45, 50, your bones start to get brittle. They start to get hollow, because of the steroids. So, I mean, it's a very risky, business that we are getting into when you're talking about steroids. And I would, strongly condemn it, if I can use that word. But I mean, it's a, personal choice-free world. But it's a scary world,
But I appreciate you creating awareness on that. It is much, much needed. The long-term side effects, especially. Dr. Akshat, before I let you go, so what are some of the simplest lifestyle changes that you have seen that has worked with your patients to reverse pre-diabetes or to make it better?
Look, I think that's like the simplest question that you can ask me, because like you said, there is no magic pill, and I agree to that. It is a lot of hard work. It is the right guidance. Okay. It is a lot of perseverance. It is about understanding what is happening in the body and what is causing the pre-diabetes. I think if we can get to the cause, then we can break it down. It is always going to fall into these 4 pillars that we talk about. It is going to be your food. You talk about nutrition, you talk about fiber, you talk about proteins, you talk about superfood, you talk about methi seeds, you talk about, bindiga pani, we talk about paneer food. It doesn't change. It honestly doesn't change. Okay. Sleep. Again, we're talking about belly fat. Okay, you cannot get rid of the belly fat if you're not sleeping on time, you're not sleeping enough. The quality of the sleep is very important. Okay, and I think I can't emphasize enough on the importance of physical activity. Now, one guarantee, if you have adequate exercise, we are not talking about under exercising or over exercising, but adequate exercise and enough movement through the day. Okay, post meal walks. If we can do this much, I can guarantee the insulin resistance starts coming down. The insulin resistance starts coming down, your pre-diabetes reversible, totally reversible. Okay. And ladies with PCOS, you will see your menses getting regular just by the right exercise. This has happened, and I see this happening all the time. Okay. And to put these 3, 4 things, you talk about smoking, you talk about alcohol, you need a right mindset. Bottom line is, whatever you want to do, your mind has to agree to that, right? Your mind has to encourage you to do it. So if you know why you're doing it, you understand the importance of doing something, you automatically get into the routine of doing it again and again, because you need to do this again and again. You do this for a short period of time, you get rough results, you stop doing it, you're back to square one. That's why no fads. Let's not go into any of the extreme behaviors. Okay, even if we're talking about intermittent fasting, we do it the right way. If we do something very extreme, we cut off all carbohydrates, we stop eating, we restrict our meals too much, maybe we will get results in 3 months. But is that sustainable? We have to ask ourselves every day, is this sustainable? I think that is what is most important from my side.
Absolutely. And I want to add also the impact of stress, because we've seen so many of our patients, they're doing well. The A1C is in control, and it suddenly shoots up in the next review. Yeah. And then you go over everything. They're following the diet. They're doing 10,000 steps, working out, yoga, but their stress levels have shot up. The only lever. So stress, your blood sugar levels. And since you spoke about sleep, which is extremely important, the latest scientific research coming out also talks about the circadian rhythms, the time you sleep at night.
Yes.
People who are highly diabetic, who sleep at different timings and later in the night, they have the most fluctuating levels in the morning. So it even shows our circadian rhythm. There's so much. So in short, it's coming back to nature, trying to live the simplest yet most abundant life. But
Correct.
Dr. Akshat, thank you so much. I truly appreciate this. It'll be nice if you can leave Tina with a list of the tests that you spoke about so
I
that
will.
she can mail this across to everyone who has joined in for the video today. But thank you so much for your time and thank you for everything you do. Thank you
Thank
everyone for
you.
joining us. Have a great day. Bye.
Thank you. Bye bye. See you.